Hello and welcome to our webinar today entitled Knowledge Mobilization and Healthy Youth Initiatives at Brock Lifespan Center. My name is Sarah Webster and I'm Knowledge Broker with Niagara Connect. Also joining us today in the meeting room is Sarah Johnson, our resource coordinator, who will be acting as chairperson for our call today. And we're excited to host this webinar on behalf of Niagara Connect. If this is your first time joining us for an event like this, obviously the audio is coming through the phone. And please do make sure that you've also clicked the web link to join us in the online meeting room so that you can see the slides today. We do record all of our webinars, and we'll be posting the recording to the Niagara Knowledge Exchange within about a week. But as a registrant of this event, we'll also send you an email to let you know when that recording has been posted, as well as send you a copy of a PDF of the slides. We encourage you to share that with any other colleagues who may not be able to have joined us today. As you noticed when you called in, all of our participant lines are muted, and that just helps us cut down on inevitable background noise, but also allows those of you that are joining in groups to have any type of sidebar conversations without pulling away from the presentation itself. So because you are all muted, if at any time during the presentation, if you have any questions or comments that you'd like to put forward, please do use the chat pod down the left-hand side of your screen, and we'll keep an eye on those questions and comments and flag them and certainly address them during our discussion period at the end of the presentation. So without further ado, I'd like to introduce our speaker today, Jayne Morrish, who's a Knowledge Mobilization Officer with the Lifespan Development Research Center at Brock University. Jayne, I'll turn it over to you.
Awesome, thank you. Hello, everyone. So as Sarah mentioned, my name is Jayne, and today I'll be talking with you about knowledge mobilization of academic research and healthy youth initiatives at Brock University's Lifespan Center. Just for a quick overview, first I'm going to give you an introduction to my role and the Lifespan Center here at Brock. Then I'm going to review what knowledge translation and knowledge mobilization are, just so we can be all on the same page there. And then I'm going to talk a bit about knowledge mobilization in the research process, going into knowledge mobilization at Brock's Lifespan Center, and speaking to several key initiatives that we have going on. And then finally I'll review some ways that you can become involved. So on to me. I'm Jayne Morrish. I'm the Knowledge Mobilization Officer for Brock University's Center for Lifespan Development Research. And basically that means that I work with lifespan researchers and faculty to create knowledge mobilization strategies for them. I also spend a great deal of my time working on grant applications with researchers, developing and realizing the knowledge mobilization sections of their grants for them. I do have a master's degree in lifespan development from Brock, and I also have a great deal of applied experience in research evaluation and knowledge translation. Specifically, prior to my role at Brock, I coordinated the research evaluation and knowledge translation activities at a nonprofit organization named SmartRisk, and then continued this role when they amalgamated into a larger organization named Parachute. I've received a fair bit of training and evaluation, and I'm currently in the middle of becoming a credentialed evaluator with the Canadian Evaluation Society. And finally, I also have training in knowledge translation. So specifically, I've received the Knowledge Translation Professional Certificate from U of T and the Hospital for Sick Children's Learning Institute. And I go back and I lead expert panels and give keynote presentations at this course annually. So I mentioned that I work with Brock's Lifespan Center, or what is formerly called the Canadian Centre for Lifespan Development Research. And I can guarantee that most of you probably don't know what that is. So the Lifespan Center is a multidisciplinary collaborative effort dedicated to studying human development across the lifespan with special strengths in childhood and adolescence. The center involves over 60 Brock faculty members representing social sciences, applied health sciences, education, and humanities, as well as numerous community agencies who collaborate to investigate how people grow and change across their lives. Some of the main topics that we research are mental health, lifestyle choices, stress and health, emotion regulation and perception, peer relationships, brain development, social cognitive development, and also atypical and typical development. Now, being part of an academic institution, our members actively publish in the scientific literature, which is great to spread knowledge among scholars, but it does leave a large gap where we were not always communicating the great knowledge that we have outside of the scholarly world. And the way that we're filling this gap is through engaging in knowledge translation and working to mobilize our knowledge outside of the academic sector. And that's one of the reasons that my role was created. So I wanted to move on to a quick poll just wondering, do you use the term knowledge mobilization or knowledge translation in the work that you do? So the options are yes, yes, but we use another term, no, and not sure. So you can go ahead and respond to that on your screen, and we'll just get a little understanding of what's going on there. Okay, so we have about 50% saying no, but we do have a fair bit of people saying yes, but they use another term, which is good to know, especially the no piece, because some people might actually be doing it, might not even know that they're doing it, or definitely probably call it something else and are just not realizing that it falls within that. So, as I said, what I do for a living is translate and mobilize knowledge, but let's talk a little bit about what that actually means. And there are quite a few terms that fall within this. So the first one is knowledge translation, or what is commonly called KT. So this can be considered an umbrella term for the process of moving research or evidence into practice. The Canadian Institute of Health Research, or what's called CIHR, they have defined KT as a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Canadians, provide more effective health services and products, and strengthen our healthcare system. Now, although the CIHR definition mentions only the healthcare system, this can be applied to a variety of disciplines. And moving beyond that technical definition, knowledge translation is really taking created knowledge like research and working with various individuals to translate it, exchange, and apply it in a form that allows for benefits to individuals who can use that information. So this could be for the public, for policymakers, for practitioners, or even for other researchers. Then there's what is called knowledge mobilization, or what we commonly call KMB, which refers to the movement of created knowledge into active use, and really comes down to ensuring that the right information is available to the right people at the right time and in the right format so as to influence decision making. So with knowledge mobilization, you're really moving the knowledge that exists into action with the people that can actually use it. And this results in evidence-based decision making and allowing for evidence-informed practice. More than just bridging the gap, knowledge mobilization seeks to make connections between research and expertise and policy and practice in order to improve the outcomes in various organizations or sectors. And now knowledge mobilization is a proactive process that involves specific efforts to build relationships between knowledge creators and knowledge users. So this idea of knowledge translation and knowledge mobilization, they're very much overarching concepts, which can be broken down into some specific components. So as I just mentioned, we have what are called knowledge creators. So this term really refers to the individuals who actually create new knowledge. So for an example, the researchers that I work with at the Lifespan Center are knowledge creators when they're doing their research. Then we also have something called knowledge users, referring to individuals who use created knowledge. This can include other researchers, key partners, media, community-based organizations, practitioners, and even the general public. So this is the term for those that actually use research and the resulting knowledge. So NGOs or policymakers who use research to inform their work, programs, and decisions are knowledge users in that moment. Then there is knowledge exchange, referring to the collaborative approach between knowledge creators and knowledge users, which results in shared learning while working through the processes of implementing and understanding knowledge. So this term describes the process of discussion and collaboration that should occur between those that make the knowledge and the people that use the knowledge, talking about what the information means and how it applies to the work and needs of knowledge users. Then there is knowledge brokering, referring to the processes where interactions between knowledge creators and knowledge users are facilitated. Think of this term as describing the middleman who has one foot in the knowledge creation side and one foot in the knowledge use side and bridges connections between the appropriate individuals. So in my role, a lot of the time I'm a knowledge broker, where I work with researchers to understand what they're doing and to see the practical side of their work. And I also work closely with community-based knowledge users to help them engage in our research in a variety of manners. And then in Niagara, we also have Niagara Connects, which operates as a high-level knowledge broker that facilitates these connections to help bolster knowledge exchange throughout our region. So that was a lot of different terms, and depending on who you're talking to, you're going to be told that the key overarching title for this field is something different. So for example, some people really subscribe to the term knowledge translation, and this is what comes up most in the health sector. It's usually knowledge translation. More recently, people are moving towards the term knowledge mobilization, as they feel that it really gets at what this field is about, moving knowledge into action to have impact. And this comes up most in disciplines that apply to social sciences or to humanities. In the business world, the term knowledge management tends to be used. In the last few years, we've seen the emergence of something called K-STAR, which is an attempt to amalgamate all of the knowledge blank words into one. And then a more old school term that sometimes gets thrown in is implementation science. So there is considerable overlap between these terms, but subtle differences can affect our understanding of the topic. For example, the term knowledge translation implies that knowledge is like an object that can be given from one person to another, whereas knowledge exchange or knowledge mobilization imply that knowledge is altered as it passes from person to person. However, regardless of the term, the underlying intent in all cases is to make research matter more in policy and practice for organizational and system improvement. So the bottom line here is that there is a need for knowledge to be translated into formats which lend to that research being useful with the people that it actually applies to. Now, if you're interested in learning a little bit more about all of these terms, there is a great article, and I have the citation up on the screen. It's just called Lost in Knowledge Translation, Time for a Map, and it was done by a few people that are leading in the knowledge translation world, and it goes through a lot of these terms much better than I can, so it's up on the slide, and it will be in the slides when they're also given out after the webinar. So moving on to one more poll, I just am wondering, what term do you use for this process? So that for those that do feel like they do knowledge mobilization, do you tend to call it knowledge mobilization, knowledge translation, knowledge exchange, knowledge management, K-STAR, implementation science, or even other? I do not use a term. And even if you're someone that thought maybe you didn't, if you think you did now, you can also say kind of what you feel would fit best for it. Because it is a very interesting debate in the field that's going on around what the term is. Okay, so we have a lot about tie between knowledge exchange and I do not use a term. We had a couple for knowledge mobilization. Okay. So definitions aside, the process is very simple. The goal of knowledge mobilization is to ensure that there is a feedback loop between research and people, and that this systematic movement of research and knowledge flows both ways. So it's to influence practice and policy, and then to further influence research. One of the biggest questions that tends to come up when we're talking about this field is kind of, why does this field even exist? Especially outside of Canada, because Canada is kind of one of the leading countries in terms of knowledge mobilization, knowledge exchange. The question, why is this happening? Well, there is something called the knowledge to action gap, where research is not always having the impact that it should. And this is due largely in part to two main issues. First is a failure on the part of knowledge creators to appropriately share knowledge. And second is a failure on the part of knowledge users to appropriately act on created knowledge. And this knowledge to action gap exists strongly today, focusing just on the healthcare system. It's been found that about 30 to 40% of patients may not be receiving care that adheres to scientific evidence, and that 20 to 25% of provided care may not be needed and may actually be harmful. And this is where the field of knowledge mobilization comes in, focusing on creating a bridge between knowledge creators and knowledge users in order to get the most updated and relevant information into action with the appropriate groups of people. Repeating something I said earlier, this field exists in order to ensure that the right information is available to the right people at the right time and in the right format so as to influence decision making. And this need for mobilized knowledge has been recognized on a world stage. As reported in the World Health Organization's 2004 World Report on Knowledge for Better Health, they take the stance that stronger emphasis should be placed on translating knowledge into action to improve public health by bridging the gap between what is known and what is actually being done. So both knowledge creators and knowledge users need to remember that they have the power to bridge this gap. Knowledge users tend to be a bit more open to this process, whereas this process can sometimes be a bit more difficult within the academic sector, which is one of the reasons it's so important to work with researchers to understand this need and to see how knowledge mobilization can fit within their pursuits. And this is why it's so important to have this level of support at academic institutions. So that knowledge to action gap may not be the top of everyone's mind, but there is another big reason to focus on knowledge mobilization that's fairly important, and that is money and budgets. So the integration of knowledge translation and knowledge mobilization is becoming a common requirement in most funding applications, be that through the government or also just external funding agencies. And this is really important inside of academia as well as NGOs and charities, because almost all grant and funding procedures expect applicants to be able to comment on their knowledge mobilization. For example, I was working a year ago on someone here at Brock who was putting in a submission to the Dairy Farmers of Canada, and they ended up having a 2-page knowledge mobilization section for their grant. So it's becoming very common that almost everyone's looking at this. And basically, through the inclusion of knowledge mobilization, funders see that they can help to ensure that their investments have applied benefits, longevity beyond set funding periods, and an increased return to society. And to boil it down, funders have seen that requiring individuals to focus on the applied aspect of their work beyond a funding timeline will generally give them more bang for their buck. So as such, in order to compete in the fast-paced world of funding applications on any level, it's really important to ensure that your own work has a knowledge mobilization plan and support built in. This will make it much more attractive to potential funders. And a lot of the time, if you have a strong knowledge mobilization component, that you actually get put into a separate section and judged differently than the other people that have put it in, because this is becoming such an important piece. Beyond funding, knowledge mobilization is becoming a very integral piece in research and implementation. And in my opinion, this renewed focus on knowledge mobilization is changing the research process on some levels. First, as I just mentioned, there's definitely been and will continue to be an impact on the granting process. Funders are seeing the relevance of focusing on knowledge mobilization and are rewarding those who can effectively comment on and accomplish knowledge mobilization. Next, there is a growing emphasis on the outputs, outcomes, and impacts of research as a key portion of the process and methodology of research. With knowledge mobilization, we're also seeing more open access to data and research information, meaning that individuals outside of the research and academic world are now more able to access this research in a meaningful way. Some examples of this include new research-based databases, open access journals, and journal requirements, and finally more publication of plain language materials. A lot of the time in the academic sector, it's now being required that if you're getting certain grants, your data has to be accessible to the public once you have it. So it kind of ensures that there's more open doors around that. There's also, this also relates to a new focus on what's called equitable knowledge sharing, which basically refers to the mobilization of knowledge in a way that is fair and accessible to the relevant audiences, which researchers are now being called upon more to do. Basically, if you mobilize your research in a format that does not apply to how a given audience can and typically accesses information, then that is not equitable knowledge sharing. For example, if on a given research project your main audience tends to have lower reading levels or may not typically speak English, and you mobilize all of your research with high-level English language materials, then that is not equitable knowledge sharing. And more and more we are seeing that researchers are attempting to, and in some cases are required to, focus on this equitable knowledge sharing, which is an important movement forward in this field. There's also a new focus on partnership outside of the academic sector and co-creating knowledge with these partners. And I'm going to explain that a little bit more later when I get into what we're doing here at the Lifespan Center. What I see happening more next in this field is a stronger movement towards knowledge mobilization evaluation. So rigorous evaluation of knowledge mobilization activities to measure impact, reliability, and retention levels, in turn helping to establish some strong embedded best practices for this field. So in terms of knowledge mobilization theory, the Lifespan Center has recognized that there are various models and frameworks for knowledge mobilization, such as what's called the theory of diffusion of innovation, the knowledge to action cycle, and most recently the work done by Dr. Vicky Ward in the UK around developing a hybrid framework for knowledge mobilization. Now at the center, our knowledge mobilization work incorporates various aspects of these models, focusing on what has been called collaborative entanglement. An approach that involves collaborative entanglement focuses on consistently developing and supporting approaches and processes that combine the sources of knowledge and the beneficiaries of that knowledge to interactively move towards a common direction, such as meeting an identified community need. Overall, this term describes the process in which knowledge creators and knowledge users work together to understand and meet their common as well as uncommon interests, needs, and goals. In order to support the process of collaborative entanglement, the Center's knowledge mobilization initiatives are put in place in a systematic and purposeful manner through understanding that there is no one-size-fits-all approach to knowledge mobilization. And as stated on our website, the Center's knowledge mobilization work focuses on collaborative and integrative knowledge mobilization, working with our local, provincial, national, and international partners from a variety of sectors to co-create research that has a true application outside the university. And we tend to base our knowledge mobilization work around three main areas right now. First is just generally mobilizing our research. The second is building internal capacity for knowledge mobilization. And the third is building partnerships. And I'll now speak to each of these separately. For mobilizing research, our efforts are focused on social media outreach and engagement, producing infographics and newsletters, and these are often co-produced in conjunction with our partners or our members, developing and disseminating plain language research snapshots, and we also run a speaker series in Lifespan Center called Lifespan Speaker Series Research That Can Inform Your Life, which are free speaking events held with external organizations and in the community on various research topics. So here are just some visuals of our infographics. And again, these are just visual ways to disseminate our research work in small snippets that convey the bottom line messages to our audiences. We only started doing this last year, and they've become really popular. And as I mentioned, we try to do these in collaboration with our partners so that they can include an application piece outside of academia. So for example, the one you'll see on the right-hand side of your screen, which is entitled Child and Youth Mental Health, we did that with some of our mental health partners from various organizations, talking about the research that they have, and then coming together to formulate what schools could do around promoting in-school mental health. So this was done collaboratively, so it wasn't just us talking about the research we have. And we're actually working right now with the school board to create two new infographics while we move forward with a really exciting research project. I see some questions coming up. I know they're for later. We are available to send these out to anyone, so you can definitely email me. And they're all available online as well. And we have some ways that you can sign up online to get copies because we mail these out whenever they're created. Another exciting piece that we do are our research snapshots. So these are just short, plain language summaries of various publications that come from Lifespan members' labs. These are extremely important as they provide a variety of audiences easy access to research. And this is discussed in all completely accessible and plain language. And we actually provide information in these for how they can get in touch with the researcher or learn more information. And these actually usually form the basis for our infographic. So all the visuals you saw on the screen before, when you view the infographic online, you can actually click any of those graphical pieces of the infographic, and it will take you to the associated research snapshot in case you want to learn more. So that's the way we've done it, that we've got the infographics go out first. They give the quick visual information, and if people want more information, they're able to click and find more as they go forward with it. And then after this, it would be that they could get in touch with the researcher themselves and find the actual journal article that it's based on to learn even more about it if it's relevant. So here on the screen, we've got one on non-suicidal self-injury and how it's linked to suicide. And that's actually based all on Niagara data with some Brock students and also some high school students. And then we've got brain activity, peers, and personality and how they all relate to each other. And these are all available on our website. So next, we've recognized the importance of building internal capacity around knowledge mobilization with all members of our center and for students at Brock, with the idea being that it's more important to help ensure that our faculty and students understand knowledge mobilization rather than just having a staff member there to do it for them. So now I host workshops for researchers and students on knowledge mobilization, terminology, theory, and strategies. We also offer grant writing workshops for our members, and then another focus is on offering one-on-one grant support to all members who ask for it. And then another large portion of our knowledge mobilization work surrounds partnership development. So working with groups and organizations outside of the center to create and mobilize research beyond what our individual reach would be. We focus on developing integrative partnerships. We work collaboratively through the research and knowledge mobilization process rather than just at the end. So we want partners that come in and help us formulate our research questions rather than just coming at the end saying, hey, this is what we have. What can you do with it? We want to actually ask questions that are relevant to what our partners' needs are. Additionally, as I mentioned, it is really important that with all these formal partnerships, we focus on that is what's called the co-production of knowledge. So this means that our research interpretation, dissemination, and questions are all developed collaboratively with relevant partners to ensure relevance, inclusion, and uptake of research. So this moves into some of our specific examples, and right now all of this work has come together in our most recent research and knowledge mobilization effort, which is called the Brock Healthy Youth Project, but we call it BHYPE for short. So BHYPE is focused on examining the link between health risk behaviors and adolescent brain development longitudinally. So specifically, adolescence is often characterized as a health paradox because it is a time of extensive increases in physical and mental capabilities, yet mortality and injury rates increase significantly from childhood to adolescence. So health risk behaviors like substance use, risky activities, physical inactivity, poor nutrition are the leading causes of mortality and injuries among youth, making this age a critical period for increasing our understanding about how these problems can be prevented. So it is well known that early childhood is a sensitive period of development, particularly in terms of brain development, and that has implications for learning as well as future health and well-being. More recently, the idea that adolescence might also be a sensitive period has gained traction. In fact, adolescence could represent a second window of opportunity for brain development, resulting in unique vulnerabilities such as drug use or mental health problems, as well as unique opportunities such as passion for social issues and learning about spirituality. With the new technologies that are now available, we have discovered that the connections among the brain regions are not as mature in adolescence as we originally thought. The parts of the brain involved in processing emotions and potential rewards appear to be fully active during adolescence, or even more active than in adults, while the parts of the brain involved in keeping emotional, impulsive responses in check are still reaching maturity. This discrepancy might provide clues as to why adolescents tend to enjoy novelty, why they become passionate about some subjects, and why they are more likely than adults to act on impulse without thinking about the consequences. So the goal of BHYPE is to provide an integrated assessment of the link between health risk behaviors and adolescent brain development, as well as their interactions with other biopsychosocial factors like personality and environmental factors. So a lot of adolescent-based brain research has been done using imaging. One of the limiting factors of this technology, however, is that it is very expensive. Thus, research in this area tends to be limited by very small samples and a narrow focus only on brain development without looking at associations with actual adolescent health risk behaviors, and there is a lack of longitudinal data. It is only by following adolescence over time that we can see whether adolescence is indeed a sensitive period for brain development and how that development interacts with lifestyle choices and environmental experiences. So the BHYPE team is a transdisciplinary team of investigators coming together from a variety of fields, including psychology, neuroscience, neurogenetics, kinesiology, and health sciences, to examine these issues. And we have received $1.43 million from the Canadian Institutes of Health Research to conduct this research over the next 5 years. Our goal is to provide one of the first truly comprehensive studies of adolescence by looking at how interactions among personality, activities, physical health, mental health, brain development, environmental factors, genetic and hormonal information impact on health and lifestyle choices, both those involving risk and those that are positive. So we're going to be addressing these research questions through a 5-year longitudinal study of health risk behaviors across adolescence. Participants will include a sample of 2,200 youth from grades 3 to 8 who will be followed for 5 years in the Niagara and Hamilton-Wentworth regions. In each of the 5 years, students will be asked to complete 2 questionnaires on an annual basis over the school year. From our sample of 2,200 youth, 600 youth will also be asked to participate in a lab component in years 1, 3, and 5, which will involve the collection of physical fitness, brain activity measures through the use of EEG, which is a much cheaper and very efficient way to collect brain imaging data, endocrine status and genetic information, so we're actually going to be getting spit samples from all of the youth. And after 5 years, we will have data for the entire adolescent age period from ages 8 to 18. So in order to ensure the timely mobilization of our research findings into prevention and intervention programs, policy, and education, we plan to provide an integrative assessment of the development of youth health risk behaviors, evidence-based support for the link between health risk behaviors and adolescent brain development and its implication for youth vulnerabilities and opportunities, annual updates of precipitating factors that impact on health risk behaviors and brain reactivity over time that are best to target in prevention and intervention programs, and the timely and widespread application of our findings given the strong team of researchers, partners, and integrated knowledge mobilization strategies. And just on the note of knowledge mobilization and partners, this project is supported by a group of highly engaged knowledge mobilization partners, as well as a well-defined knowledge mobilization plan. Right now we have just over 30 partnering organizations. So some of the people that we have signed on include the World Health Organization, Health Canada, the Mental Health Commission of Canada, Canadian Centre of Substance Abuse, the RCMP, UNICEF, Niagara Public Health, Pathzone, and also the Niagara Catholic District School Board. And we're also adding to this partnership list continually. And one cornerstone to BHYPE is that we are working with all of these partners collaboratively to develop research questions that are relevant to their work, interpret our data from a variety of lenses, and mobilize the findings effectively into relevant programs, products, policies, and tools. And I'm also happy to report that we have started data collection in Niagara, and it's been going quite well. So we will have our first wave of data done before the spring of this year, and we'll start then working to mobilize this back within Niagara over the summer months. Another kind of community-based knowledge mobilization piece that we've recently started is something called Growing with Brock. So Growing with Brock is a member-based program where individuals and families can learn about opportunities to participate in research at the Lifespan Center. As I've highlighted through this presentation, one of our main mandates are to conduct research and to ensure that this research is being mobilized effectively. In order to do that, we need engaged participation in our research studies. And Growing with Brock functions as our participant outreach program that helps to ensure that we A, have participants to continue our research, and B, are engaging with community members and organizations around research. So Growing with Brock is completely free, and it's open to anyone in the Niagara region or further if they are willing to travel to participate in our research, as the majority of our studies do occur at Brock. Some member benefits include invitations to participate in new studies, newsletters on results from developmental research, offers to attend our speaker series with experts in the field, and also access to exclusive Growing with Brock events. And why is participation important? Well, first, it helps to contribute to new knowledge in important areas of development. It tends to be a fun and unique outing, especially for children. They basically get to come in and be junior scientists at the Lifespan Center. It typically involves a very small time commitment, about an hour. We offer very flexible scheduling and free parking for anyone that's coming in. Some studies offer a gift card or entry into a draw as a thank you. Children tend to receive a prize. You can bring a friend with you. It really tends to challenge and stimulate your mind. And it also really does help students collect data for their research. And just one note on this, we've just started this, so it is a very, very new initiative, and we're currently piloting it with a small group of Lifespan researchers who helped to start the Growing with Brock program. And we're focusing really right now on younger children research and also older adult research. So even if there's organizations that target that and they're interested in learning more, you can always reach out and we can touch base with you as well. So before we move on to questions, I wanted to let you know about how to get involved. So if you want more information on our knowledge mobilization or you have general questions about the Lifespan Center, you can reach me, and my email is jmorrish@brocku.ca, or you could always email our general account, which is lifespan@brocku.ca, and someone will get in touch with you and probably refer you to me. And that would include if you want any copies of those infographics and stuff like that. If you're interested in learning more about Growing with Brock or even signing yourself up or a family member, you can email growing@brocku.ca. We have our main research, which is, our main website, which is brocku.ca/lifespan-development-research. Here, right on the main page, there's an opportunity where you can sign up for updates, where we send a few emails a year highlighting upcoming events, new knowledge mobilization materials. So whenever we get a new infographic out, we just send it out over email. We also have a website for BHYP, so that's the Brock Healthy Youth Project, which is brocku.ca/BHYP, BHYP. And then finally, you can follow us, engage with us on Twitter, and our account there is Brock_LDRC. So that is it, and I think I move forward and we move to, if there's any questions, and I think it's going to be Sarah is going to be helping us moderate those.
Absolutely. Thank you, Jayne. And I appreciate the intro to the knowledge field, I'll call it, with all the different terms for it, because I know it can get a bit murky, and that was really helpful to set the stage there. And certainly interesting and exciting to hear about what you've got on the horizon now, but that we'll see a lot more as the years go by and you move further in that research.
Mm-hmm.
We do have a question here from Rachel who says, I'm interested in hearing more about the hesitancy from knowledge creators to see the benefits of connecting to the users themselves.
So this is, and I'm not saying it happens all the time at the Lifespan Center, but this is my experience has been, I think in the academic world we've all heard the term publish or perish. So it's the big piece is getting research done, and it's getting grants, and it's a very fast-paced world. There's a lot of things that researchers or faculty members here have to do. Teaching is a big thing as well. So sometimes knowledge mobilization and partnerships can fall to the side because they want to get these main pieces done. And it can sometimes be hard to move outside of as an academic, you're typically trained to talk in your academic language. You go to conferences. This is what you this is the world you live in, and then to suddenly have to move into a world of talking with people outside of academia and talking in a different, quote, language level and moving into plain language or talking more about applicability and implication can sometimes be hard. And then basically what I find is moving people along by helping them do that, so starting the partnerships conversation with them, starting the end user conversation with them, and really also showing how this fits within their granting process has been helpful.
Awesome. And Jayne, are you seeing now that this has been happening and certainly it's been embedded in the granting process, are you seeing a shift with researchers to now that there are more partnerships with the community
I
and
definitely
with end
am.
users?
Yeah. I am for sure, and I'm also seeing when you take the time to sit down one-on-one, like when I do those workshops and explain this to researchers and explain the idea that, hey, did you know that this organization exists in Niagara? You can connect with them. So for example, the Niagara Folk Arts Center, I've connected a couple of researchers to them because that's a great partnership piece where they could work with them to mobilize their research, and I'm hoping they've connected with them. I know at least one has. And giving them examples, and it's just really helping to stretch their thinking. And I've seen it's moved a fair bit, especially the big one is that big grant we just got has shown the success of that.
Wonderful. And it's great to see and hear about when the public is also informing the research questions themselves, and you talked about that with the Healthy Kids piece as well, right from the beginning, that there's involvement in the research process.
Yeah, and we actually did that through Niagara Connects, which was very helpful, and so Niagara Connects is becoming a big piece there as well.
And certainly a lot of your infographics that you spoke about and the research snapshots are on the NKE as well. So in our follow-up package, we'll make sure to link those out as well to people. Any other questions from participants or experiences that you'd like to share with respect to your own work in knowledge, mobilization, translation, exchange, K-STAR?
Or any challenges you've had, because that's interesting feedback for me about challenges you've had about reaching research and things like that and trying to move through this process of knowledge mobilization.
Rachel says more about the co-production of knowledge and getting members of the public up to speed on complex research topics.
So that can be a challenging piece. So with us, we've just learned that it's going to take a lot of time investment, and it's been unique that we have my position here in the Lifespan Center, so I'm moving a lot towards a partnership piece. So I'm the person that, again, has that one foot in the research world because I understand it and I have a master's. but I also have worked in the field outside of academia. So it's having that key person who can bridge the connections for them, because it can be hard to get them up to speed on these complex research processes in a way that they can understand it. So I think it's really important to have that one person in place that will help to speed that along. It can be quite difficult though. And Rachel, I'm happy to chat with you after. Rachel and I are actually colleagues, so we can definitely chat more about that as well. I can give you more examples.
We got a share from Rachel. Thank you. Any other questions or comments for Jayne? And certainly I know, Jayne, you've been so responsive throughout this process. I'm sure if someone goes home tonight and at 3 o'clock in the morning wakes up with a question, they can certainly reach out. Probably by email would be best.
Yeah, probably don't call me at 3 in the morning, but I might be up because we're in the middle of data collection, so it's insane right now. But yeah, definitely if anyone, A, has questions about this, or B, if you're working at an organization and you see relevance towards the research that we have going on here at the Lifespan Center, again, basically our commonality is how people grow and change across their lives. If that is something that's relevant to your own organization's mandate, please reach out to me, and I'm always happy to talk more about partnerships and pieces like that, and things about how we can work together to ensure that you're involved in our research process and we're involved in your process, so we understand what questions you need answered, and we can make sure that our research aligns with that.
Wonderful. Awesome. Okay, well, thank you, Jayne, for taking the time today to share this with us. And as I said, we'll certainly send out a resource package within about a week with a link to the recording, PDF of the slides, and some of the other references and resources that Jayne talked about today. So thanks, everyone, for taking the time to join us today, and enjoy the rest of your afternoon. Take care.